Well, first, some encouraging news, Greg. Hospital leaders say they're making progress working with state officials to open up beds, but they say that might not be enough to accommodate a new wave of COVID patients.
Honestly, our heads are spinning a little bit about how fast it is spreading.
Doctors at hospitals across Washington are expressing concern about how they'll handle an influx of patients sickened with the COVID Omicron variant.
We really do not currently have the capacity within our facilities to accommodate a large surge as we just came through with the Delta surge.
Studies have shown Omicron to be less severe than earlier forms of the virus, but the wave of infections is expected to be widespread, and doctors say some patients, especially unvaccinated people, will require specialized care.
Even if it's a small portion of the overall total, this could mean a huge number of people getting sick enough to need hospitalization. And they're going to be needing that hospitalization in a system that's already more than maxed out.
So you can see in all these adjacent rooms, they're all full.
As we've been reporting, the Washington State Hospital Association says the crowding situation is not because of COVID, but due to a backlog of patients who really should be in long-term care or nursing homes. The association says hospital leaders had a productive meeting with state officials this week to try to speed up the process of moving those patients out of hospitals. Medical centers, meanwhile, are having to keep a close eye on their capacity and adjust as needed.
So right now, we are not thinking that we are going to need to move patients outside of our system, but our overall capacity, it's a constant moving of patients from site to site, triaging from the different emergency departments.
The Hospital Association says it's been preparing for crisis standards. That's when hospitals might have to ration medical care if their facilities are overwhelmed with patients. But they tell me all of the state's hospitals are in this together and will share the burden as needed. They say other states don't have that level of cooperation. Greg?
All right, Ted.